Alexa, what's the importance of technology in nursing?
Here's something I found on reference.com. The integration of computer technology into the nursing practice has been necessitated by a need for proper records.
Thank you. Where would we be without our smart speakers, our phones, our Apple Watches, our laptops, our tablets? Listen, technology has integrated and infiltrated every aspect of who we are as human beings in this modern world. It's also done the same in healthcare. And as nurses, we need to know how to manage the technology appropriately. So today we're going to be talking all about technology and informatics in healthcare. Oh, and Alexa, put romaine lettuce on my Costco list. So we're going to be talking about technology and informatics from Giddens chapter 46 and David's chapter 41. Grab your concept study guides, grab your books, some highlighters and a pen, and let's study together today, shall we? So here's what you need to get out of this lecture today. Can you believe this is our last lecture for 107? Where has time gone? We're going to complete your concept study guide, which you are a pro at by this point, and you're going to answer these following questions. How does healthcare informatics benefit nursing? How does it benefit patients? What are some guidelines and some cautions to take when considering the safety and ethics of informatics? And when we're looking up information, how do we know that the internet source that we're looking for is accurate? So let's go ahead and start by defining and describing the concept of technology and informatics. Informatics may not be a word that you use in your everyday life, but it's certainly something we need to know. So let's take a look at the definition. We've got three definitions here. One is technology in general terms, which is the knowledge and the use of tools and equipment and processes that help us solve human problems. And then health informatics is this process where both hardware, like computers, phones, watches, and software, like applications, computer programs, are all used and integrated to help us collect, store, assess, and distribute health information for patients. We can use this within the profession, like from nurse to nurse, nurse to doctor, and we can also use this as a communication tool to our patients. So we know that technology has made us more efficient and safer in so many aspects of our life, including when I'm making my grocery list. And the idea is that it'll do the same for healthcare. It makes us more efficient. It helps increase safety as we have all the data in front of us, and it can improve patient outcomes and quality. So health IT is the hardware, the computers, the actual structural things you need, and health informatics is the collection and sorting of that data. And together, health IT and health informatics intertwine to give us this great technology healthcare delivery system. It's using a variety of tools and this infrastructure to increase data sharing, data analysis, and data collection. I think this graphic really helps to understand how technology and informatics kind of intertwined. So health informatics is the study of the different software and data collection tools and processes that we can use, where the health information technology is the actual hardware that is used to collect the data. And here's a great example. When I used to work in the ER and I was working as the clinical educator, my computer would break down, right? And I would call Jim. Jim was our health informaticist. And I'd be like, hey, Jim, my computer's broken. He's like, Meredith, call IT. This is not an informatic thing. This has nothing to do with data, patient information. This is your computer's broken. Call IT. So IT is the one who handles things like hardware, computers, passwords. And then Jim is a health informaticist, is the one who's going to say, okay, how are we collecting our vital signs and how does that look on our chart? And how does that look next time the patient comes in? And how does the provider see past vital signs? So he's dealing with the data where IT is dealing with the passwords and the hardware itself. Okay, so attributes and criteria. We're talking about hardware and software, both the actual tools and the applications. We're talking about standardized information systems and terminology. There have to be policies that are put in place to keep this safe. There has to be a high level of privacy and security so that there aren't breaches in patient information. There's an informatics workforce. Did you know that you can be an informatics nurse, like my friend Jim, and spend your days working on developing amazing EMR systems, electronic medical systems, that make it easier to collect and store and analyze data for patients? So cool. Okay. Healthcare in technology can do amazing things to help us and our patients. We can track patients and their visits. We can track equipment and where equipment goes. We can manage healthcare staffing and workflow, reducing errors by having red flags pop up on our computer when we enter something. It can aid patients with self-care. My dad has these wireless blood pressure medicine, blood pressure cuff, and weight scale and blood glucometer at home that all wirelessly transmit to his nurse at the VA, helping him with self-care and self-management. It can help us perform and document patient care and clinical tasks, and it also can help us manage our time and tasks, lay things out in a way that's really easy for us to understand. So it makes us more efficient, it makes our tasks easier to understand, and makes us more safe. Electronic health records have a lot of great benefits as well. They improve efficiency, productivity, and continuity of care, improves accessibility, and can prevent or reduce physician order entry errors, and has a lot of public health benefits as we can use that to track metadata. When my son was taken to the ER for his broken arm, we went to a closer ER from where he normally gets his care. And they were able to, even though it was a completely different hospital, they were able to pull up all his medical records from the other place where he gets his care and see what medications he's on and his allergies and his past medical history. And it was all there at a push of a button without me having to recall all those things at 1 in the morning. And so it was more accurate because they could see exactly what the other providers had put in his record at previous visits. Now, there certainly are some ethical considerations when we're using electronic records. You never share your password with anyone. It is very important that when you're putting things in the medical record, that it is you. If it says that you're the one documenting it, it better be you documenting it. There can be audit trails where we find, what records have you been in? And so you should not be in patient records that you don't belong in, and they can see exactly who's been accessing those records. And they're going to hold you to HIPAA, making sure that patients' information is held private. So if you are pulling up information on your computer in the medical surgical unit and you go into a room, you better take down that information on the computer so it's not standing there in the hallway for everyone to see. So making sure that we're maintaining privacy with our medical records. So what kind of things do nurses document in the electronic medical record? I'd encourage you to head over to Davis, page 1117, table 41.1. Take a look at that first column and see an example of EMR documentation. So as we talk about privacy and security, HIPAA law comes into play. We talked about that in the legal lecture. HIPAA means that we maintain patients' privacy and security and confidentiality. And there are laws, specifically a law called HITECH, laws and regulations that address patient privacy and their consent for the use of identifiable personal health information. Public trust is still a concern. We hear about breaches in data breaches in the news all the time. And it is still definitely a concern and something that health IT people work very hard to maintain. My brother actually he does IT stuff, and he used to work for a subcontractor of the VA, and one of his whole jobs was just maintaining privacy and security of the VA medical records. One of the things that electronic medical records have done is vastly improve our ability to communicate with our patients and with each other as healthcare providers. And so the interrelated concept of communication is so strong with healthcare informatics and technology. Electronic communication like email lists, distribution lists, and text messages can really improve patient conversations and physician conversations. When I was working in the ER, we got the ability to just take pictures on a secured app and send pictures of an EKG directly to the cardiologist who was on his way in, to care for this heart attack. And we could pull that up and he could pull it up on his phone so quickly. And so it really decreased the amount of time in order for information to go to providers. And it was great for the physicians to be informed on what we were doing with the patients in the emergency department. Certainly telehealth is a huge new component of our health system, especially in the post-COVID world. And being able to just see patients electronically can really increase our accessibility to patients, make it easier for patients to connect with their healthcare providers. And certain EMRs these days have really nice messaging systems, even within the app itself, where patients can easily send a message or question to their provider or to the provider's nurse and have better communication with their provider. So better communication from providers to providers and better communication from nurses to patients and vice versa. Good news, you can skip a little bit of reading here. Just skip over the theoretical link section for the purpose of this lecture. So let's talk about ways that technology and informatics impact healthcare as a whole. So there's three domains of health informatics. The clinical informatics, meaning how do we use electronic medical records and technology in the healthcare setting. And most of the time, this is going to be things like electronic health records, secure texting between providers. And then you've got the consumer health informatics, all of the ways that patients can be informed about their medical treatment, their care, get education and counseling, and have so many resources right at their fingertips. And then the benefit of public health informatics, where de-identified information is shared broadly with the government, and we can see trends in our public health stats as in general. De-identified means the data is shared, but not anything about the patient themselves. So we're looking at big data, not at the individual level. And this can inform things like we've looked at Healthy People 2030. This can inform things like that in terms of what the government sets as healthy goals for the public going forward. But the EMRs are not the only benefit of informatics to nursing. Informatics has greatly improved the ability to have that evidence-based practice for nursing. We at our fingertips can have access to hundreds, if not thousands, of nursing journal articles indicating the best research and best practice on our ever-changing healthcare system. So it gives us rapid access to the most current health information, and it gives us easy access to navigate and find and search by keywords what topics we're looking for in terms of research. But not all data is considered the same, right? Not everything we know on the internet is correct. We learned that a while ago, hopefully. On page 1124 of Davis, it gives you some tips to know if information on the internet is accurate. And I'd encourage you to pause here and go ahead and read through that yourself. As you can see in this interrelated concept slide, how informatics and technology influences almost everything that we do in nurses. And just like I am tied at the hip to my cell phone and I talk to my smart speaker all day long and she tells me the news, she plays me the radio, she adds things to my Amazon cart. Our lives are integrated with technology in our house. They're integrated in technology in healthcare, and you can see that on this interrelated concepts map here. These featured exemplars are really key in ways that we integrate with technology on a day-to-day basis in healthcare. Computerized nursing documentation, oftentimes known as an EMR or an electronic medical record. Barcode medication administration makes us safer as we scan the med, we scan the patient's band, and then that all pulls into the chart and says, yes, this is the right patient at the right time with the right dose and the right drug, and it gives us all of our rights because we scanned like a grocery store, scan the patient, scan the medication, and we're good to go. And then, like I said, the electronic health record is larger than just nursing, and it integrates every aspect of healthcare, all of the different providers, as well as patient direct access to their healthcare providers through apps like MyChart is a common one that we're going to see patients use. So as we wrap up this lecture on information technology, it's your last lecture for 107. Congratulations for getting this far. I'm so proud of you. And thank you for all the hard work you've done studying along with me. But as we wrap this up, I would encourage you to take a minute and just reflect on the impact of technology in your day-to-day life, because I know it definitely is a huge part of what my day-to-day life looks like. And then consider what that's going to look like in nursing for you, because it's just as integrated in the nursing and the healthcare world as it is in our everyday life at home. We need to be expert users of that data, and we need to be cautious users to use it both ethically and appropriately. Thanks for listening. I'll see you later.